4 San Antonio Ashley Home Stores.
Sinus problems can make a person's life miserable. Here's the deal, though. You don't have to live with all of those symptoms any longer. Katrina Zedan with American Sinus Institute is here, along with their patient, Albert Estrada. Good morning, you guys.
Good morning.
Thanks for being here.
Thanks for having us.
I know a lot of people deal with sinus issues, not just, a few months out of the year. They're really suffering throughout the year, right?
Right, exactly.
It's a problem all the time.
Yes. So we have patients that come see us with sinus pain, sinus pressure, headaches, and we have our patient here today who also came in with the same complaints, but mostly sleep apnea with him. So we don't really attribute sleep apnea with sinus issues.
No, I wouldn't have.
So
yeah.
he has a story to tell today about that. So.
Yes, I had a sleep study done several years ago, and it was determined that I had sleep apnea, and it was due to having a deviated septum in my nose. Had a severe blockage on one side, and the other side was blocked pretty well too. And I had been told that need to have the surgery done,
Yeah.
but I know that traditionally the method was the old
Very invasive,
very
and
invasive, painful.
Yeah.
I just kind of dreaded having to do that and kind of put it off. But I knew that as I got older, the sleep apnea was going to have some long-term effects. So I went to go see my primary care physician, and he suggested to me that I go see Dr. Honrubia at the American Sinus Institute. And when I did, he said, "Oh no, you're a candidate for the balloon sinuplasty."
Oh, wow.
So I had it scheduled, and everything went great. It was a easy outpatient procedure.
In and out, no pain?
None at all. And I mean, it's like night and day. I can honestly say, I sleep so much better.
Like a baby again?
Like a baby, no snoring.
Yeah.
And one of my exercises, I like swimming, and it makes a big difference when I'm swimming, that, be able to breathe better.
It really has changed your life, you would say,
Definitely.
huh, Albert?
Oh, for sure,
Yeah.
yes.
And I'm sure this is something that you hear after people have this procedure. I mean, it really does change their life for the better.
It does, it does. It helps them with energy during the day because they're able to sleep
Yeah,
better.
because you're getting rest at night.
Right, and the sinus headaches are a big deal for patients too. So they think they have migraines and they're actually sinus headaches, and so they're off their migraine medications. People off their inhalers now. I mean, it really is a big difference.
So what are the symptoms? If people are having which symptoms exactly should they give you a call?
So sinus pain, like we talked about, sinus headaches, or even headaches generally. If you have congestion in the nose and you can't breathe, sometimes teeth pain, but you go to the dentist and then there's no dental issues.
Wow, okay.
Come see us for that as well.
It could be that.
Right, exactly. A lot of drainage. So when medication fails and you're taking so many medications and frequent sinus infections and you're taking a lot of antibiotics, and the medications have failed you, or medications have not worked, or they work only temporarily, come see us.
Okay. And if you are a candidate for the procedure, as Albert had mentioned, it's super simple. It's an in and out procedure. There's no downtime, correct? So it's so much better than traditionally.
Right. I mean, I had the procedure done myself, and I was
Okay.
back to work the next day.
That's
So
great.
Right.
Okay. And insurance? Some
Insurance, most insurances we take. We have billing personnel that they'll answer any questions you may have in regards to the billing. So.
Got it. So you can give them a call and they'll set up your consultation, answer any questions you have, but you do not have to suffer any longer. Call the American Sinus Institute. They're on De Zavala. The number is 210-BALLOON or 210-225-5666. You can also go to americansinus.com. Thank y'all so much for being here. All right, everyone. And